Hi everyone, we are Team 25, no questions unanswered. Our team's from ThoughtSpot and includes Graham McConnell, Helen Ching, Ryan Garrett, Phil Bayless, and Callie Wright. We're going to show you how leveraging search and automated insights can support the Commonwealth of Virginia's mission to reduce new COVID-19 cases and opioid addiction. Virginia exposes this information today across multiple data sets, but the public does not always have the tools or the background in analytics to consolidate the data or easily ask questions to understand how they can help to make a change. Our solution empowers the community and state employees with self-service access to information so they can make faster, data-driven decisions when the next epidemic, pandemic, or major event occurs. Everyone from the Governor of Virginia to frontline caseworkers can use this solution to easily ask questions and immediately see trends by overlaying COVID, mobility, census, and opioid data from multiple data sources. Let's start by asking, how many cases of COVID per 1,000 people are there on a weekly basis? While this shows a fluctuating trend, we really need to bring in more data to visualize the effect of the lockdown. Here we're looking at mobility data that tracks the distance cell phones are moving from their central location, typically the owner's home. The greater the distance the phones are moving, the greater the index. We immediately see the effects of the lockdown based on how much we've moved around and where people are at risk. I want to save this for my analysis later, so I'll quickly start building a dashboard with my insights. There's a lag between when the lockdown occurred and when the case count decreases. These charts here suggest that the lockdowns could have a positive effect at reducing the number of new COVID cases. If we scroll below, there are trends and anomalies auto-generated to help answer relevant questions we have not considered asking. Here we can see activity at a pharmacy may be unusually high, or a positive correlation between mobility and COVID cases. It's automatically blending with my opioid data. No one can predict where people will want to drill. We can support drilling anywhere. Let's drill down to this peak to further investigate. Here's a breakdown of COVID cases for this day by county. Darker colors indicate a greater concentration of cases. Let's quickly isolate the top few counties. By doing that, we immediately see which counties we want to focus on as potential hotspots based on a case count by population. We'll go ahead and save this to our dashboard for further analysis. Let's go ahead and dig deeper into the data and look at demographic details. We can quickly narrow our focus to ethnicity or even poverty level to see if there's a greater risk of contracting COVID or abusing opioids. We want to focus our attention on high minority populations. We can even break this down by specific minorities if we want to. And we can quickly identify which counties we need to prepare with tests, PPE equipment, and testing facilities. As the pandemic has collided with the substance abuse epidemic, drug overdoses have climbed 18% according to a national tracking system at the University of Baltimore. With data from DEA focused on opioid use and distribution within Virginia, we can help you understand down to the zip code level and within a 1, 5, 10-mile radius where treatment facilities should be established, where you need to better educate residents who have a higher risk of addiction. Let's start by analyzing the pills per person by county for the last 3 months. Let's go ahead and narrow it down to the top 20. Visually, it's obvious there's a lot of activity in the western part of the Commonwealth, but we also see an issue emerging on the eastern side as well. Let's go ahead and drill down to Lancaster County, Virginia to see the trend of opioid purchases. And we can break this down further to a weekly level. We might want to even further enhance our analysis with our forecasting scripts. Using R, we can see the forecast is trending up. This means that pharmacy sales of opioids may not be as high now as it is in other counties, but the trend is moving in the wrong direction. Let's be proactive and see if we can get a better sense of what's going on so we can take action. To get a full picture of what's going on in Lancaster County, Virginia, over time I can easily pull in and consolidate mobility, COVID census, and opioid data in a single analysis to start asking questions and seeing automated insights. We see mobility is trending down, meaning people are being more responsible, but we're still seeing an increase in COVID and opioid abuse. With PII data, we can get even more granular to make immediate decisions around how we support and handle the growing number of COVID cases, as well as how we support education and treatment options available to curtail opioid addiction. That concludes our team's showcase on our innovative search and AI analytics platform to support the mission of public health at the Commonwealth of Virginia.